Hello, this is Peggy with Massage Publications, and today I'm going to talk a little bit about core misalignments and how they affect the rest of the body. So what do I mean by core misalignments? Well, in my practice, I concentrate on the most common kind. I mean, there's a lot of variations on this theme, and I always assess for a high iliac crest, a rotated pelvis, an upslip of the SI joint, a leg length discrepancy, a pubic bone misalignment, and a sacral torsion. And in my years of being a body worker, I've discovered that these are the most common. And all of these misalignments can and do affect the rest of the body, and you just never know. So here's a story to illustrate that. I had a client come to me. She's an avid swimmer. She loved her swimming, and I'll tell you why a little bit later. But she was having very painful neck rotation and to both sides, flexion. So her pain pattern was all in the neck and the upper back in the thoracic spine. She had been to several other massage therapists, but her relief had only been temporary, about 24 hours. So I tested her for these very common core misalignments, and I found that she had an anterior rotated pelvis on both sides, a high iliac crest on the right side, and she also had a short left psoas. So that's not a classic core misalignment, but we all know how much the psoas affects the rest of the body. And it's always good to check that muscle to see if one is short, because it can cause a core misalignment. So before I worked where she was feeling the pain, neck, thoracic spine, I corrected those core misalignments. And then I worked on the painful neck and thoracic spine. One session, she was good to go and was able to go back to her beloved swimming. And I think she only needed to come up for a tune-up of a couple of months later. So Ida Rolf used to say, where the pain is, the problem is not. So pain patterns are important, but they don't tell you the whole story. And speaking of stories, here's why swimming was so important to this woman. She had a terrible, terrible case of Morton's neuroma in both feet. And Morton's neuroma is inflammation of a nerve sheath, usually between the second and third metatarsal. Hers was so bad, it required surgery. The surgery made it worse. So she was actually wheelchair bound for 10 years, if you can imagine that. And that's why swimming was so important to her. She could walk now, but only short distances. So I'm picking out one common core misalignment, and that's a rotated pelvis. So here is part of the pelvis, one half, and that's where the head of the femur would fit in. And the pelvis has a neutral position, which is just slightly anterior. That would be neutral, up to a ½ inch. So you could have an anteriorly rotated pelvis or a posteriorly rotated pelvis. So an anteriorly rotated pelvis, some of the impacts of that would be low back pain. You're going to have a lot of stress on some of the spinal muscles, hip pain, bursitis at the greater trochanter, and knee pain. And so an anteriorly rotated pelvis is really a prime time player in knee pain. So when the pelvis rotates anteriorly, what happens is that the knee tends to fall towards the other knee or medially, which causes a foot pronation. So all of this stuff gets a whole kinetic chain reaction. Now that the issue of the knee falling medially could be coming straight from the foot. So you have to check out both ends, but so often it is just coming from a pelvic misalignment. So who knows how many knee surgeries have been done over the years that really could have been corrected a long time ago before things got too bad, because over time that really is going to affect the joint and all the tissues around the joint and the cartilage and everything. How about a posteriorly rotated pelvis? Well, one of the most important functional movements we have is the ability to hinge forward, keeping our spine nice and long, and that requires the pelvis to hinge on the head of the femurs, okay? But if your pelvis is posteriorly rotated, your ability to hinge is going to be compromised. And so what happens when you drop your pen and you need to bend it up, if you have a posteriorly rotated pelvis, you're probably going to end up flexing too much through the thoracic and lumbar spine. And ideally, we want to mitigate that, let the legs and the pelvis do most of the work, and get a really good hinge going. So those are a couple of key points about core misalignments in general, and specifically a rotated pelvis. So I hope this was beneficial to you. If you'd like to find out more, you can go to Massage Publications 5 Tips to Stabilize the SI Joint, because all of these misalignments really impact the SI joint, and that is in the description below. It's a pitch-free article. I just put it out there because I want to give you tools, techniques, and strategies to really serve your clients with excellence. Okay, see you in the next video.